So let us talk about risk factors of stroke. We have a number of risk factors of stroke. We're going to enumerate some of them. Normally before now we had classified risk factors into modifiable risk factors and non-modifiable risk factors. So I'm going to just take a few of these risk factors. What are risk factors? Risk factors are otherwise known as predisposing factors. The factors that can predispose someone to having a particular medical condition. The factors that can lead to a particular disease condition. And of course, what we're talking about now is stroke. Number one is hypertension. Untreated or mistreated hypertension can lead to stroke. Number two is diabetes mellitus. Untreated or mistreated diabetes mellitus can lead to stroke. When you don't manage these conditions well, then it can lead to stroke. Number three is excessive alcohol intake or excess alcohol consumption. If you don't moderate your alcohol intake, it may lead to stroke. Of course, we advocate, if possible, stop drinking alcohol at all. Number four is smoking. Of course, smoking is a risk factor of stroke. So if you don't mind how you smoke, you will end up having stroke. It is difficult to stop smoking, especially when you are addicted to it. Then call your healthcare provider. It will take you through what we call smoking cessation. Then definitely it is worth it. You can actually quit smoking if you are ready to do that, because it has good health benefits. It will prevent you from having stroke. Number five is intake of certain food substances or bad food habits, like taking food high in sugar level, salt level, cholesterol level, and spices, and so on and so forth. So if you don't moderate how you take these food substances, you may end up having stroke. Number six is physical inactivity or lack of adequate physical activity. If you're not physically active, don't do regular exercises, you may end up having stroke. So we're going to stop here. Like I mentioned before, we have other forms of risk factors, like age, medical history, family history rather, and so on and so forth, age, race, and ethnicity. So, but these ones I mentioned are actually the ones that you can do something about them. You can work on yourself. You can look at the kind of food you are eating and prevent the intake of some of these food substances I've mentioned. You can become physically active by doing regular exercises. You can stop or reduce your intake of alcohol or stop taking alcohol entirely. You can quit smoking. You can, be serious with how you manage your hypertension and diabetes. So with that, you can prevent the occurrence of stroke. So see you next time. Stay locked on this channel until we see you next time. Thank you.